Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula County Health Department's COVID-19 response. Today is Tuesday, January 12th, and this is our COVID briefing. We've now had 6,955 cumulative positive cases of COVID-19 in Missoula County to date, with 30 new cases since yesterday. We've had 58 deaths associated with COVID-19 to date, and currently 18 Missoula County residents and 12 non-county residents remain hospitalized in Missoula County. We now have 334 active COVID-19 cases. Those active cases and their identified close contacts remain in isolation and quarantine and are being supported and monitored as needed. Remember that all of these numbers, as well as the graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 87,077 cumulative COVID-19 cases, which is up 439 new cases since yesterday. There are now 4,827 active cases, with 187 active hospitalizations across the state, and there have been 1,067 deaths related to COVID-19 statewide. The University of Montana has had 501 cumulative COVID-19 cases since the beginning of fall semester, and there are currently 13 active cases associated with the University of Montana. Spring semester started yesterday, so we're definitely keeping an eye on any activity that might come as students have returned back to Missoula from the holidays. As we saw declining cases and the holidays, we wanted to give everyone a little bit of a break from the briefings. Now that the holidays have passed by and we're seeing an uptick in new COVID cases, and as we're rolling out vaccines for COVID, we are going to go back to twice-a-week briefings. You can expect to see those briefings get posted on Tuesdays and Thursdays. Today, I'm going to focus on vaccine. First, let's talk about the vaccine phases. So phase 1A is a phase that we're currently in, and that phase includes frontline healthcare workers, long-term care, and assisted living facilities, and that includes both residents and staff, and healthcare workers with direct patient contact or virus exposure. We are a regional medical hub with thousands of frontline healthcare workers, so it's taking us a little longer to get through phase 1A in Missoula County than it may take counties with smaller population of healthcare workers. We are working with our community partners to refer out patients who signed up to get vaccinated through us to help us get through our queue as quickly as possible. We're also looking to secure a site for a mass vaccination clinic for phase 1A workers, and we're working with the University of Montana in order to aid us in that effort. We will release more details on that when our plans are all finalized. If you are a healthcare worker with direct patient contact and you have not yet received your first dose of vaccine, you can go to our website and you can sign up through a form. You can find that link at missoulainfo.com/vaccination. So what about phase 1B? Safety is our top priority, and there are a lot of major safety considerations that we're troubleshooting for a mass clinic before we invite the most vulnerable people to come and get vaccinated. The safety of this group is not something that we're taking lightly, especially as we're starting to see another uptick in cases in the community. We're also working to ensure that there are multiple distribution points across the county for vaccine once we get into phase 1B, because that is going to be a very large phase, and we're looking at thousands and thousands of people that will need to get vaccinated. So stay tuned, and we will get you more information once we get closer to wrapping up phase 1A and are ready to move on to getting those phase 1B folks vaccinated. So last, on a positive note, Montana is 10th in the nation for vaccine distribution per 100,000 people, according to the CDC. So while it may feel like the vaccine distribution is going slow, we are one of the best in the nation. And we're currently working with our local partners and the state health department in order to collect the data on how many people have been vaccinated in Missoula County, and we will start sharing that with you, and we'll post it on our website as soon as we have that information. So that's it for my briefing for today. It was pretty short. Just wanted to kind of give you a little bit of an update on what's going on the vaccine front, and you can expect to hear from me again on Thursday. As always, you can subscribe on YouTube under my name, Cindy Farr. That's CindyFarr. Click that notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page, and check out our website at missoulainfo.com. If you are having any symptoms of COVID-19 and would like to get tested, please call 258-INFO, and they can get you scheduled for a COVID-19 test through our Flynn Lane drive-through testing facility. And that's it for today. So everybody stay healthy, and I will talk to you again on Thursday.